All right, ladies, we're going to learn how to work our superficial skin layer after having our C-section delivery. So you would want to start this around 6 weeks postpartum, the closer we get to the scar, on top of the scar, once you've been released from your doctor. But you can do some of these techniques up above the scar itself to help create more mobility as your tissue's healing. But again, please avoid the area on top of the scar until you're at your 6 weeks postpartum or until that your doctor has released you. So we're gonna start with the skin layers, really this upper top layer sitting here on the abdominal tissue. And one thing you can start doing is just skin rolling the tissue side to side. What you're looking for here is tightness. You may come to a point where it's not moving as well, and you can just gently pull that area left to right as you're walking or skin rolling across the abdomen. You can also work this tissue up and down. So you want to check that tissue, like how well is it moving up towards her head or your head. And then as it comes down, most abdominal tissue and most C-sections after childbirth move more coming down and less as you pull up. Side to side matters, really differs from individual to individual if it's going to move better left to right. And then what you can also do is work on feeling that tissue in a clockwise and counterclockwise fashion. So again, staying more superficial, just on top of that skin layer, and moving it gently side to side or around and around. Coming down a little bit closer to that scar. But again, if I'm not 6 weeks postpartum, or if I have not been released from my doctor, I'm not going to go on top of the scar. Once you've been released and that scar is healed, you can come on top of that tissue and test it out. Clockwise, counterclockwise, mobility up and down. And left to right. And then what I like to do is I like to actually stack the tissue. So when, for instance, say our patient here is more tight going up than down. You can see she has more mobility with the scar moving down, less mobility coming up. So we're gonna hold that there. And then we're gonna feel, what does the tissue feel like to move to the left compared to the right? So right now she is more tight when we move the tissue up and more tight when we go to the left. So I'm gonna hold that there. And then, so we're holding it in up, holding it to the left. And then from here, I'm gonna feel, what does it feel like to rotate that tissue around? So for her, she's tight going up, she's tight going to the left, and she's tight coming back around to the right. She moves pretty freely that direction, but not here. So we're gonna hold this here. And that might feel a little uncomfortable. It might feel a little burning. It might feel a little aching. Do you feel anything else besides that, Megan? Okay. And then you can release it. The burning sensation, the uncomfortable discomfort in tissue as you're doing that, when you stop, it should stop. But if you do feel it like it's burning or itching, that is more of a scar tissue feeling. So again, if I know, I'm gonna keep track of this in my notes that we have in the program, where I would be tight coming up if I was Megan, and then I would be tight going to the left, and I would be tight trying to rotate the tissue back to the right side. And I would watch that over the next couple of weeks to see if that improves as I'm doing my scar tissue day to day. So our goal here is trying to get tissue mobility, trying to get blood flow, circulation, to help improve all of this tissue here. Okay, guys, that is our superficial skin layer. If you have any questions, please let me know.